So I'm sitting here with Nate Master from EmpowerU. Nate, I'm just going to let you introduce yourself here. You're a physical therapist, so tell me a little bit about what you do and why you do it.
Yeah, I appreciate you having me here today. So Nathan Lee Master, I am founder and owner of EmpowerU. We are located here in Sioux Falls, and we are a cash-based performance therapy company. So we're a little bit different than traditional physical therapy. We try to divorce the term physical therapy. Everybody has their own thought process of what that is, of working with post-ops or an elderly population only, and kind of going from there. So we added in performance therapy because we are with people no matter where they're at on that journey, and making sure that we can meet them at that point in order to make sure that we can help them obtain their goals.
So performance therapy, what exactly is performance therapy? Tell me about that.
So performance therapy is you come in to us with a ache, pain, or injury or anything like that, and essentially you are hiring us to be with you on the journey. We are not being hired to tell you exactly to stop doing what you're doing. Unless we think it's detrimental to your care, then we'll put everything on pause. But up front, it's, hey, you want to keep doing what you're doing. And most of the time, we've realized that the majority of individuals, they're already working out, they're already trying to press through, and they can do they're going to do it no matter what. And so we say, hey, you know what? Let's look at this from a different lens. Let's find the root cause of what's going on. Let's continue to do what you're doing, but let's add a different lens. And we have an array of treatments through dry needling, manual therapy, therapeutic exercises in order to make sure that they're seeing the results that they can.
I love that term of performance therapy, which honestly was the reason that I met you, because I came to see you. I am a client of yours. Do you remember? You have so many clients. I don't know if you remember the first time I came to see you, but I remember the first time
I do. You were very skeptical of seeing me.
I was. I did not trust you as far as I could throw you.
Not at all.
But my husband actually recommended you to me. He had seen you first. And when I first came to see you, I had chronic low back pain, which a lot of people have, I think. My injury was due to, all started back in my 20s playing hockey. So very thankful for that experience so I could carry back pain into the next 20 years of my life. Anyways, when I came to see you, I'd been an athlete, I'd been a runner all my life, but I had stopped doing really what I loved to do. I still did a lot of activity, but I had taken running out of my life because it just caused me too much back pain, and I would have these flare-ups. So I really came to you for help, but I really had not had great experiences in the past, so I really didn't trust you initially.
Yep, absolutely.
So I have since been with you probably about 2 years or so. And really, you took me from, when I first came to see you, I remember I said, all I want to do, I don't want to run again. I ran for many years, but I don't need to run again. I said, I just want to be able to run around my yard in terms of just playing football with my son, those types of things without bad back pain. That's when I first came to see you. So we've been working together for almost 2 years now. I see you, I don't know, anywhere from once a week to a couple times a month. Not long ago, I went on, my brothers invited me on a hiking trip. Now, you've never met my brothers, but they are avid hikers. And they basically, they're taller than me, they're thinner than me, and they run up mountains like gazelles. They're crazy. So I decided to go. And the three of us we went out into the middle of nowhere. We flew to Utah, we drove for hours. Our cell phones didn't work. It was literally the middle of nowhere. And we hiked up a mountain and back down for a good about 7 hours that day. And this was not like putzing around hiking, mostly walking. This was running, almost running the whole time on uneven terrain. So we did that and I survived that. And then later on that evening, we got to a hotel at like 10 p.m. We crashed for a good 8 hours. We got up in the morning and then we did another hike, not a hike, a run. We ran around the rim of a canyon. So basically, in about 24 hours, I did 18 miles over rugged terrain. So I contribute a lot of that to you. I mean, yes, I did things on the functional medicine and longevity side to help myself, but a lot of that was my journey with you. So I went from basically saying all I want to do is just be able to, play football in the yard with my son to be able to run up and down mountains. So.
Which I'd say that's one of the things that we see with a lot of our clientele. They want to come in and we ask them what their goal is, and their goal is the lowest hanging fruit because it's just something that feels safe to them. And so what feels safe and yet special is saying, hey, I want to run around the yard with my kids. And you start thinking about, oh yeah, this injury happened 20 years ago and this is just a part of getting older. But then you chose to kind of take health into your own hands and then take the step forward and try something different. We understand that at the same time, like EmpowerU, we back cleanup. Everybody else likes to try insurance and everything before us. And then eventually when they get fed up or feel like they're getting looked at through the exact same lens, then that's when they try to come to us. And I felt like that's where it was at with you. And it's a very emotional journey. You come in and a lot of times it's a lot of frustrations, a lot of fear, quite frankly, a lot of anger.
Yeah, I kind of hate a lot of my sessions with you. I like you as a person.
Yes.
You're amazing. But I don't like coming to see you. And I tell you that all the time.
Absolutely.
Because there's a lot of work. Like
Yes.
it's hard work coming to
Yes.
see you. You're going to push me. You're going to push me past what I want to do.
Every time. But then the fact that I'm able to push you and then also to show you and be the professional in the room that this is what I think is best for you, whether it's dry needling techniques or manual therapy techniques, which you absolutely despise of, and then making sure that
I kind of despise all of it.
yeah, and then as long as we continue to push forward, then we're able to have that compounding interest over time. And don't get me wrong, there's plenty of times that you could have been like, yeah, Nate, I feel better than I felt 20 years ago. I can be done here. But the thing is as you've said in the past, like I can't quit you. And that's because you've realized that the compounding interest that is that you can get better and better and better the more that we focus on this stuff. There's different levels and different abilities that you can go through. And now that you're telling me that you're going on runs on a regular basis and feeling good, and then now I'm sure to you, it almost seems silly just to go back and say, hey, yeah, I just wanted to run around the yard with my kids. And now you're traveling and doing all the things. Yes. No. Yes.
And I think that's also where a lot of our clients align is we want to determine goals and then we want to surpass those goals. We kind of want to crush those goals.
Absolutely.
So when it comes to the people that you see, I know that a lot of the people that you see also end up coming over to me. And it's the same thing on my end. There's a lot of people that I see, they also need optimization through you. Mm-hmm. They're just different ways of doing that. Mm-hmm. So for example, when people come and see you, they're in a lot of pain. Mm-hmm. And so that's also one of the reasons why people come to see us, and often we do different things. So for pain management, because we are a clinic that does non-narcotic pain management as well, people have no idea sometimes the origin of their pain. And so just like you are looking for a more mechanical root cause to that pain, mm-hmm. we are also looking for root causes of that pain. And it can be a number of things. We're going to look into hormones especially because hormone imbalance can be a significant cause of pain, whether it's dysregulation of cortisol or an under or overperforming thyroid or checking to see testosterone levels, estrogen levels, progesterone levels, all the things. Hormones significantly are a big part of the pain process. And so we're going to look at that, and then we're going to look for even autoimmune disease. Some people have no idea that their pain is originating from autoimmune disease.
So in terms of hormones and autoimmune, what are the things that maybe some of the listeners might see or feel or notice when it is that versus something mechanical?
Right. That's a really good question. So when it comes to autoimmune disease, people start to feel like they have all over joint pain, especially joint pain. And the pain is not, it's bilateral. It's not just on one side or the other. So if someone says to me, I have bilateral hip pain and shoulder pain, or pain in their joint, in their finger joints or their wrists, they kind of have this systemic overall pain everywhere. So that's one thing I will definitely make sure that I look for autoimmune disease with. In terms of hormones, as people get older, but not even, people think that they need hormone replacement later on in life. We actually believe now that you need hormone replacement much sooner, sometimes in your 30s, 30s, 40s, 50s. You start to get older and you just start to have a lot more pain. And so that can be an imbalance, again, of testosterone, estrogen, progesterone. And so we'll check that and normalize and optimize those numbers.
I love the word optimize. Like that is definitely something that we go back to so many different times at EmpowerU, especially talking through, okay, how do we optimize each other? How do we optimize the business? How do we optimize our clients and everything from there? Because when individuals are coming in, their number one thing is, oh, I'm just getting older. And that seems to be the number one excuse. But the thing is, we've realized that by putting in the work and looking at whether it's blood work and blood panels, which we can't do, but then our side, as far as just like focusing on mobility first, what is the most simplistic thing that we can do? And then so let's start with mobility, then move to stability, and then in terms of optimizing, and then once we're at a really stable spot and then you still want to feel better, let's start to look at the deeper levels of that.
Normal doesn't mean optimal. So normal just means that that is a common number of that value for your age. So let's just take vitamin D, for example. Vitamin D levels in their 30s are technically normal. However, optimal vitamin D levels are at least over 60, maybe even 75. So we try to get vitamin Ds up to the optimal levels, not just let them sit in the normal ranges. Because literature says if your vitamin D is greater than 40, you have a significantly less risk of getting cancer. So we try to optimize even beyond 40. We try to optimize up to between at least 60 and 75.
And especially when you, I mean, normal. So in terms of PT, a lot of times they call that baseline. And when it comes to baseline, most of the time, especially when insurance companies chooses to discharge you from different PT companies or anything like that, they're trying to get these PT companies just to get you to your baseline. But the baseline is not good enough. The baseline is what got you in trouble in the first place. That is what got you injured. That's what got you on your surgical table or anything from there. So baseline is essentially like when therapy or medical intervention should actually not only start, but continue even further and double down. Because at that point, that is where you can then move up your baseline and start to enhance actually your potential of being a human and what you can accomplish.
Right. I think people are realizing now that they don't feel great at baseline.
Yes.
Baseline's not where they want to be. And so that's why they come to us. That's why they come to you. And that's why they come to me. They want to feel their best. Because that really, when people come in, they're coming, they may be naming a bunch of different symptoms, but really what they want is they want to feel better or they want to look better. And so they might say, you know, I need help with my skin, or I'm just feeling really fatigued, or I just don't feel like myself again. I don't have any energy. I've got pain everywhere. But really what they want is they want to feel better and they want to look better. And we do that for them. But we also help them age better, because aging doesn't need to mean decline. And I think that is also something that you do too. You work with all decades and really help them make this decade be their best decade of life.
Absolutely. And I mean, even speaking for myself, like I've got 3 kids and a 4th on the way, and constantly I want to...
Coming very soon.
Yeah, it's coming very soon. And it's one of those things that it's just like, you know, I wish at times like, oh, I felt as good as I did once upon a time. But the thing is like my body's not the same. My aging mechanism, my metabolism, it's all not the same. So I need to switch things up. So once upon a time, I used to have all the time in the world to hit fitness and go for runs and do these different things. But now with 4 kids and running a couple businesses, I don't have that opportunity. So the time that I do have, I need to understand it more. Is it healthier for me and my body type to weightlift? Is it more important for me to go for a run? What are the supplements that I can do in the meantime to optimize every intentional moment so that I can be even more intentional with my wife and my kids?
Right. And we find that especially with men, especially men like you, high functioning individuals, executive types, entrepreneurs, you're running a business, you've got a family, you've got young kids, you're taking care of everyone. And those are the struggles that men are facing, you know, like they don't have time. So they really need a guide and someone to help educate them. Okay, what do I need to do? You know, how do I get help? How do I get help with more sleep? How do I get help with stress management? You know, everyone will say, or maybe when you go in and you're not feeling well, they'll say, well, get better sleep or reduce your stress. It's like, of course, we'd all love to do that, but nobody knows the tools. And that's really where we come in, because for both of those things, we have testing and we have plans that we help with people. So we really work with people to improve sleep, and actionable, personalized plans that help them improve sleep. And the same thing with stress. We will check their stress levels, and then depending on the situation, we have great interventions that actually help reduce stress. And that's what people don't understand, that stress is actually treatable. It's not just some unattainable thing out there.
People just trying to reduce things out of their life. To
Right,
less
exactly.
stress.
Right.
Yeah, and I mean, talking specifically to men's health, one of the biggest things is when we started EmpowerU, probably within the first 6 to 8 months, 90% of our clientele was only female. And the majority of the time, especially with only female, typically between 35 and 50, we were in a hot yoga studio at that time, so I understand the demographic there. But for the most part, it actually took a proof of concept first from wives or friends or girlfriends or any of that in order to even bring up the fact that there is something additional to help. Because what I've noticed, especially in myself, there needs to be that proof of concept. There needs to be a little bit more. There needs to be something that is different, that I realize that if I'm going to invest my time, I do need to feel drastically better. If I'm going to invest my money, I need to feel drastically better. And so I've noticed that over time, the more that we're around, the more that we're out there, the more word of mouth and everything, like it is becoming more normalized that men are willing to ask for help. And I would definitely say they're a lot slower to do so, but trend is coming, and it's okay for that to happen, because you can feel less stress, you can feel less pain, and you can optimize who you are from day in and day out, have better workouts, have better days at work, but also have better nights where you're not completely exhausted.
Right. And I think it is surprising sometimes with men. Sometimes it's the little things. Sometimes it's the small tweaking of their lives, and we'll help them with diet, lifestyle, supplementation, coaching, all kinds of different things that we will incorporate into each individual plan.
Mm-hmm.
But sometimes it is minor tweaks that help to make them feel so much better. And they come back and they're like, I don't know how, but I feel so much better already. Whether it's like I'm getting such better sleep or my stress is reduced, I just overall feel better. Another way that we do that is when we look at your labs, we will come up with a plan for you, but then we will recommend checking labs every so often. And then we'll be looking at two things. We'll be looking, are your labs actually getting better?
Mm-hmm.
And we want to see improvement there. And then every time you come see us too, we'll be checking symptoms. And are your symptoms getting better?
Mm-hmm.
So those are the two things that we make sure to keep checking back with people to make sure, again, that they are getting better. Yes, you feel better, but let's also check each individual symptom. Is that getting better or worse than when you first came to see us?
Mm-hmm.
And so the improvement is really fun to see.
Oh, and I definitely attest to that, because as we've kind of already alluded to, you've been working with me for a while, and essentially working with you and picking your brain and different things going on. There was one point that I had told you that I was beating my head against the wall because I had gone to like 3 or 4 other healthcare providers, and I had dizziness going on. And being a PT nerd, I had Jake at EmpowerU go through the Epley maneuver and all the things for dizziness or thinking ear crystals, and they couldn't prove any of that stuff. So then I went to the doctor, and then they had told me that I had a terrible ear infection. So I had terrible ear infections. I got scarring in the inside of my ear, and they kept just telling me how terrible it looked. Medication after medication after medication, and nothing worked. And I remember bringing it up to you, and I try to keep the two separate, but I was just like, Angela, I feel like I'm going to die. And I was just like, I'm dizzy all the time. I can't figure it out. It's not positional dependent or anything from there. And you're like, all right, so have you tried X, Y, and Z? Yes. All right, now it's time to do your blood work. And that goes back to optimizing health and what you're feeling and going from there. So being over a year and a half ago, having this discussion with you, and then from there getting that done, and then you taught me about folate and how my body can't break certain things down, and going from there. And then honestly, after I was able to get on B12, completely changed my life. Yeah.
And that is so simple, really. But just knowing your genetics, it's a little bit of a different genetic variant where you can't process things, maybe as easily, or methylate things as easily in your body as someone else, and need a little bit more B12 than someone else, and now you feel amazing. It's that simple. It can be.
Yeah, and that's what
it's more complicated.
Yeah, and that's the thing, especially in this day and age with Google, ChatGPT, and AI and everything from there. You plug all these things in, and quite frankly, it scares you to death. And it's just like, oh wow, I've got 19 red flags. This is great. I'm gonna go talk to somebody smarter than me now. So it's
Not smarter, just trained.
but yeah, so like that's one of the things, and it's just like it's really nice to be able to have somebody to have that conversation with and genuinely get down and explain to what it is, but also say, hey, you know what? If you don't take care of this, you're at a higher risk for Alzheimer's and all these other things. But if you do take care of it, yes, you're still at a risk, but we can minimize that to as small as possible. And that is something that changed my mentality around it and has been really good. And I've never been extremely disciplined about medication. I always thought, all right, work out harder, eat a little bit better, less caffeine, and you're ready to rock. And then I realized, you know what, getting older and running businesses and stress and life, those things add up over time.
They do. And as you age, you can be depleted. And you said too, it's like there's so much information out there. And that's really what we try to do here is be a guide for you. It's because, and we're all trained on the American Board of Anti-Aging. So we know all the latest literature that there is on longevity medicine that is out there. So that's what you need. It's not that you're not smart enough to figure it out. There's just so much out there going on. And there's so much that's true and there's so much that's not true. So you really need a guide to help sift through it all for you and help educate you and give you choices according to what your goals are. Okay, here are the choices. These are the things that I would maybe recommend for you, but then I give that back to you and be like, what do you want to do? How do you want to move forward? These are our options.
Absolutely. And I mean, same thing over at EmpowerU. We try to provide the best terms of options by being the professional in the room, much like you've kind of demonstrated today and even in past sessions that you and I have had together. It's just like, okay, what do you want? Do you want to get back to your baseline? Do you want to get back to what is the standard baseline? Okay, well, then you're going to go with option A. Option B says, hey, let's go above and beyond. Let's feel the best version of yourself. Let's make you feel a couple of years younger. All right, option B it is. All right, you want the Mecca and you want to take this thing the full 9 yards and you're ready to be disciplined. Here's option C. Let's go ahead and get after it.
You had mentioned a little bit when it comes to Alzheimer's and cognitive disease a little bit ago. Let's talk about that because that's a big thing for both men and women, actually. They're worried about their cognitive health. Maybe they have some history where in their family they've got Alzheimer's disease, or they notice some brain fog in themselves, or they notice that they're not remembering things as well as they used to. So that's something that we do here is help people improve their cognitive health. So we have a genetic test that we can test. We have multiple genetic tests, but one of them is called ApoE. Are you familiar with that?
Not too much. Tell me more.
Okay. ApoE is a genetic test for Alzheimer's. So there's really, you get one variant from your mom and one from your dad. So you're going to have two ApoEs when they come back. And so there's ApoE2, ApoE3, and ApoE4. ApoE3 means you have an average risk of Alzheimer's. So you're at no higher risk or no lower risk for Alzheimer's. But if you have an ApoE4, you're at an increased risk for Alzheimer's. If you have ApoE2, you're at a decreased risk for Alzheimer's. So people will come back, they'll be like an E2, E3, or an E3, E3, or an E3, E4. So we'll work with those people, especially those E4s, ApoE4s, to really reduce the risk of actually getting Alzheimer's disease. Because data suggests that even if you have the worst variant and you have an ApoE4, both of your strands come back as a 4, you really still only have up to 60% chance of actually coming down with Alzheimer's. There's still 40% chance that you won't. So if you work really hard with your cognitive health, and that's what we help people do, we educate them on what is good for their brain and bad for their brain. And we work really hard with those people to prevent Alzheimer's as much as we can, and then help them lead healthier lives with a healthier brain for as long as they possibly can. Things that we do, I like to use the acronym of, it's called Bright Minds. And it's a way for me, and I will explain this to clients too. It's not my acronym. Somebody else came up with it, but I like to use it because it reminds us all the time of what are all the things that are going to affect my brain. And so Bright Minds, let's start with B, that's blood flow. Anything that's going to reduce blood flow to your brain is going to be bad for your brain. So alcohol, nicotine, marijuana, caffeine, those are just a few things. So you're just going to want to think about the times that you do that. Maybe if you do any of those, you maybe want to reduce those. So anything that's going to increase blood flow to your brain is good. Exercising, working out, things like that. R, when we think about retirement, when we're going through the acronym again, Bright Minds, BR, retirement. As you age, we want to do things that are anti-aging. So when we have clients that are considering retirement or in retirement, we always advise them, okay, yes, we want you to cut back, but we don't want you to quit working completely. So even if they do quit their job, we recommend that they do consulting. If they're not going to do consulting work, then we make sure that they do volunteer work, anything that's going to keep them pretty busy and pretty active and keep their mind going. Moving on, BRI, inflammation. Inflammation is huge. There's all kinds of ways that we can get inflammation in the body, but we want to think about this, especially this chronic low-grade inflammation that we have going on. Inflammation of the gut lining, inflammation of the brain, and so we really work with people to reduce inflammation. G stands for gut health. Again, we want to repair the gut microbiome. There's a huge connection between the gut and the brain. You've probably heard of leaky gut syndrome. What that really is there's a thin layer of endothelial cells in your gut lining. And those cells are held together by these things called tight junctions. So it's supposed to be a permeable lining in your gut. When those tight junctions get inflamed, and they can get inflamed by a number of things, even high stress. Cortisol is very inflammatory to the gut. So when they get inflamed, those tight junctions will pull the cells away from each other, and so that lining gets more permeable. And so the stuff that is supposed to be staying on the inside is leaking out to the outside, and the stuff on the outside is leaking in. So that same lining or a similar lining is in your brain, in the blood-brain barrier. So we have testing that actually tests your gut to see the inflammation in your gut, how much inflammation there is, and then we repair those. And by repairing that gut, we also repair a lot of the inflammation that's going on in your brain. H, if we keep going through the acronym, H is head trauma. Head trauma obviously is bad for your brain. We take extensive histories with people. If they have had head trauma in the past, concussions, contusions, football players, things like that, then we'll get pretty aggressive in our treatment plans moving forward for protection. T, toxins. There's all kinds of toxins that we're taking in. One of them is, even for an example, food. Some of the main toxins, food. If you're not eating organic, which is why we try to encourage people to eat organic foods, especially fruits and vegetables, because that will reduce the amount of pesticides. If you're not eating organic, you could be taking in up to 20 different pesticides a day by eating some of the most common fruits and vegetables. Another main toxin is mold. So, and microtoxins, metals, things like that. So we work with people to kind of detox. It's one reason why saunas are so good for you, is you can sweat out a lot of toxins. M, minds. M is for mental health. We do a lot of work with people on mental health. And there's so many different ways that you can improve your mental health. When we think of mental health here, I go back to optimization. We think of optimizing your mental health just like we would optimize your physical health. We don't really look at mental health as a problem, because everybody has mental health issues, whether they admit it or not. Even if it's not on the regular basis, at some point in their life, they have gone through something that has affected their mental health. So there's a number of ways that we help with mental health, and that's going to include, when we come up with plans for people, that's going to include dietary changes, lifestyle changes, coaching changes. There's a lot of really good and really interesting supplement changes for mental health. We help with sleep, and when we help with sleep and stress, that in turn improves their mental health. So there's so many things here that we can do for mental health that don't necessarily require a medication. We're very supportive of medication, especially if people need it. And then if people need additional help, we always refer to psychiatry, psych NP, and therapy. So just continuing through the acronym, I is infections and the immune system. The immune system is tricky, and so we help a lot of people with autoimmune disease, and so you want to make sure that that immune system is not gone into overdrive. So infections, same thing. You want to make sure that you treat infections if you have them. N is neurohormone imbalance. So this goes with all of our hormones. If your cortisol is dysregulated, if your thyroid is overperforming, and then the sex hormones. Testosterone has been proven many times for men and women to improve cognitive health. Estrogen's been proven to improve cognitive health. So all these hormones are really, really important for your brain. So we want to make sure, again, that those are optimized. D, diabetes. We want to be very aggressive with blood sugars. And that comes back to, when we talked about the conversation between having a normal number and an optimized number. We're not going to wait until you have diabetes to treat your blood sugars. We're going to start a lot earlier. There's been a very significant correlation between blood sugars and cognitive decline. And you'll even hear the term now, type 3 diabetes, which they're calling Alzheimer's. So we're really aggressive with blood sugars in a number of different ways, but we really want to optimize that. An example that we have is, when you go in traditional medicine, they will make sure that your fasting blood sugar is under 110. That's a number that they're okay with, sometimes under 100. We really want to optimize your fasting blood sugar actually down to lower than 85. So that is our goal for most people, depending on the situation. And the reason being, I know we're talking about cognitive health, but there is literature that if your fasting blood sugar is greater than 85, you have a 40% increase in the risk of sudden cardiovascular death. So blood sugar is tied to a lot of disease. Blood sugar is related with cancers. Blood sugar is related with cardiovascular disease. Blood sugar is related with Alzheimer's. So we get really aggressive with blood sugars. And there's so many different things that we can do to track and help bring those numbers down. So Nate, what do you see most often in your practice when it comes to men? What are the common problems that you see?
Common problems, first off, is just waiting too long. The majority of the time that they don't want to be in therapy or rehab or different things for a long period of time, but then they kick that can down the road and then it ends up needing to be longer than it had to have been if they would have just asked for help. But most of the time, especially in our males, it's going to be low back pain, radiating from one side to another, shoulder issues, neck, migraines, different things like that are typically things that we're seeing. But we're realizing like, hey, if you ask for help when you have something that's going on, whether it's something with your workouts that's holding you back or something that's taking your concentration at work or home, ask for help. We can do that. We can help you.
I love that.
Yes.
You're right. People wait way too long.
Yes. I'd probably say most of the time when they're coming in, they just want to optimize their workday. They want to feel better at work, but then they don't realize how this is going to affect them on the back end of that. How can they feel better after their work hours? How can this improve their ability or their want to actually go to the gym or anything from there? So being able to work with them and open up their state of mobility. And that's honestly one of the things that we really try to hone in first is individuals' mobility, because most of the time they're stuck into such a small frame that the body remembers this, and the body is so brilliant that'll actually shorten your neural system. It says, hey, your money-making position is sitting in a desk from 8 to 5, and so it's going to want to stay in this small position. Well, that's also been linked to depression. That's where they a lot of times say, hey, have your superhero posture on, because quite frankly, that's what opens up endorphins. So does movement. So making sure that you're going through the mobility side of things and opening up and having a wider array of movement so your body's so not afraid of it, but it's also not pushing back on you when you end up doing that.
Movement is huge.
Yes, absolutely. I remember at a point in my life when I couldn't even touch my toes, and I thought I was impressing my wife by being able to get down to my knees, and she said that's a joke. So then we started yoga that next week.
So some of the main things that we see here at the clinic that men are coming in for It's fatigue, it's weight gain that they haven't had in the past. They're not able to optimize their muscle anymore. And it really is low desire, low libido. So when they come see us, they have these complaints. And then what they don't realize as we start getting into it and looking into it is there's a lot of stress and burnout that we treat. There's a lot of, we do sleep optimization. People need a lot better sleep. And then really we also look at, all their underlying labs, get those optimized, especially hormones.
Mm-hmm. So with some of these individuals that are struggling with sleep or fatigue, that seem to be the underlying factors for the main reason that they might be coming at you, what is your biggest suggestion or a couple tidbits that they would benefit most from in order to improve those?
So we have a lot of interventions that we do for sleep and stress, actually. We encourage people first to get a wearable. And so that helps us, again, get more information so that we can actually track what is really wrong with their sleep or how much stress they're really having. So
like wearable, you mean like an Oura Ring?
Right, like an Oura Ring, a Whoop, any of those that will actually track your sleep. And so we'll kind of take a look, we'll follow that, and then we'll take a look with them and we'll find out how much deep sleep they're getting, how much REM sleep they're getting, and just getting that information, then how many hours they're getting when they're starting their sleep and stopping it. That really helps us come up with a more personalized plan of how we treat them moving forward. And then in our plan, we'll have a bunch of different recommendations. And again, some of those are going to be lifestyle or dietary. Some of them might be supplemental, and then some of them might be medications. So really the most important thing when it comes to sleep is getting some more advanced testing to really find out any underlying causes of why you might not be sleeping well. Again, whether it goes back to cortisol or your thyroid or any number of things, nutritional deficiencies, etc., of how that could be affecting your sleep.
So what are these kind of tests that you're talking about?
So we do a comprehensive evaluation that includes a number of things, really. It looks at nutritional deficiencies. It's going to look at your liver and your kidneys. It's going to look at an advanced thyroid panel, advanced cardiovascular panel, and advanced metabolic panel. It's going to do some genetic testing to take a look at a few different genetic variants. But all this information is really helpful in determining any underlying causes that could be affecting your sleep.
It's very fascinating.
It's really cool stuff, actually. So we see two main groups of people here in our clinic, and one of those people, they have a whole slew of symptoms. They don't feel well. So when they're coming in, we know what we need to fix. Now we're going to look into everything else and uncover everything that might be causing that. But the other group of people that we are seeing, they don't know how to optimize yet. They just know they want to optimize. So they're coming to us and they're looking to us as, what can I do? They want the lab work that we have. They want the genetic testing that they have. They want to uncover problems that they might see in their future. So can you relate to that at all? Do you see these two different groups in your practice?
I'd say 99% of individuals start working with us because they have some sort of pain, sign or symptom that they are aware of, that they've Googled, that they've tried to get treatment for, or anything from there, and that is what brings them in. It's eventually it breaks off into a separate path. Some people, it says, hey, I'm good enough here, this is great, and then it turns into that second path, and that second path is the ones that want to raise their baseline, that they now realize that there is more for them. Because when you find somebody that's skilled enough to work with in the medical field, what you do find is that there are levels to that. So you can continue to dry needle or do manual therapy techniques, because what that can do is we can say, hey, yeah, your back pain started here. Your back pain is a symptom of what's going on, but you know what? One of your hips is not working as well as your other hips. So then we start to treat both of those. As it continues to progress and their back pain goes down and their hip starts to move better, all of a sudden their knee starts to give them the bother. Well, you know what? Your knee is now bothersome because you've had a compensating pattern because of this hip that didn't move very well for a long period of time, which led to the low back issue. Then you kind of chase that rabbit a little bit more. And then once those things all get situated, then they're like, yeah, you know what? I feel pretty good, but can I do more?
So I now know what dry needling is and what manual therapy is, but tell people who may not know what that is.
Yeah, so dry needling, it's a very fine tip needle. It got its term dry needle because you can't actively inject anything through it. So these are very fine tip needles. Most of the time when you're actively dry needling, you don't actually feel the needle being inserted. You actually feel when it hits a specific muscle, as you've experienced in the past. Yes.
Yeah.
So you feel like a small muscle
Some people
twitch.
like it. Some
Yes.
people find it very relaxing.
Absolutely. And
I don't necessarily, but a lot of people actually
that's
do.
kind of your optimizers, the ones that have been stressed for a long period of time, and then this is their way in order just to kind of find a way to relax. Some people were trying to fix signs and symptoms, and those are the ones on their first couple sessions that they're not a huge fan of it, but it's a very powerful tool because it brings back blood flow to the area. It can re-educate the muscles, and the skill of dry needling comes knowing where your landmarks are and hitting that exact muscle group. And then you re-educate it, and it gets it really tired over time so that when you're done with the needles, the manual therapy is that much more effective. You already have the increased blood flow, and then you can start to get better movement from those different segments and areas.
And again, manual therapy. Explain that.
A lot of hands-on work. So what we can do with our hands in order to make your body move better. So the dry needling is essentially working the neuromuscular system and re-educating muscles, increasing the blood flow, where manual therapy is more the musculoskeletal side of things, where we're trying to get those all to move and play nice together. So in terms of males, what is the best way for you to optimize their health, or what are the reasons that you're seeing that they're coming in, and what is the best way to help them, especially just with their understanding of what functional medicine is?
So when we think of optimization, especially for men's health, a couple things come to mind. Lipid panels or cardiovascular health is essential.
Mm-hmm.
So a lot of young people actually come in, people who are in their 30s, and they're super fit and they're doing all the right things. And then when they get their advanced blood work, their advanced cholesterol panels don't look that great. So they actually have early cardiovascular disease starting.
Is that due to genetics, or is that due to the food intake, or what is that?
It's due to both. It can be genetics, and it can be things that they're doing in their lifestyle. So what we do is, instead of just the main ones that traditional medicine will check, which is going to be your total cholesterol, your LDL, your HDL, and your triglycerides. It's mainly what they'll check on the outside. What we do here is an advanced lipid panel, because when it comes to plaque formation, it's a complicated process, but there are two main components. One of the components is why we care about cholesterol at all, is it's not necessarily the cholesterol, but what is the cholesterol being carried around in, what is attached to the cholesterol. And so we look at these apolipoproteins. And so when we do an advanced lipid panel or an advanced cardiovascular panel, we will look at what type of apolipoproteins does the client have. And if they have apolipoproteins that are bad, that have been shown to be the beginning of plaque production, then we will target those proteins and try to reduce them. So the other component of cardiovascular disease is how sticky and inflamed is the lining of your vessel. And so we'll look at that. We'll look at inflammatory markers. And so we'll also work on that for reducing inflammation for clients, because we are finding that these people who are young and healthy have these early stages of cardiovascular disease. And we know that cardiovascular disease doesn't start the day you get a heart attack. It starts decades earlier. So that's really what longevity medicine is. It's working on wellness and prevention. It's working on this disease that is starting, the beginning processes are starting decades before you get full-blown disease. So a lot of men come in wanting testosterone therapy, and we do that here. But with testosterone therapy, you need to be careful because it needs to be done right. So some of the first things we do when a client comes in wanting testosterone therapy is, number one, we'll do all the advanced testing, all the advanced lab work that we do to make sure that we optimize everything else in their body as well. Because testosterone therapy is not going to work well if you have cortisol dysregulation, or again, if you have thyroid, underperforming or overperforming thyroid, or if you've got metabolic syndrome going on and some prediabetes or climbing blood sugars. That all is going to affect your hormones. So your testosterone is not going to be working right and not optimized if those other things in your body are not correct. So we really work on optimizing those as well. Another thing with testosterone is you have to be careful, because once you start testosterone, you have to be committed to using that for the rest of your life, because it's one of those hormones where if you replace it, your body's going to recognize that you're not getting it, so your body's going to reduce its production. So people are sometimes unaware of that. So we really go through that with them and say, are you ready? And also we'll look at their levels and see if their levels actually need it. Sometimes people come in and their levels are high, and we show them, like, you may have all these symptoms. You may have fatigue, you may have low desire, you may be gaining weight, you may have some burnout, but it's from other reasons, and it's not actually the testosterone. So giving them testosterone at that point with high levels would actually harm them. So it has to be done right, and it has to be done carefully, and it has to be done in consideration with all these other things and the full body approach to hormone replacement therapy.
So in terms of unique testing or different things that you guys do at Accelerate that might be a little bit different, what are different things that you offer?
Well, I could talk forever about this because there's so many cool and exciting things out there. But a few things that come to mind is there's actually a physiological age test. So it'll give you an idea if you are either advanced or behind in terms of aging. That one's really cool. There's some very interesting genetic and cancer screening. When it comes to cancer screening, there's all kinds of things we can do. We can look at your underlying genetic risk for cancer, but also there's now a new test that will test just your blood. It's just a blood test that tests for early detection of cancer. So not only can you look for your predetermined risk of cancer, but you can also look to see if you have cancer in your body right now.
At what age would you suggest somebody starts to do that? Is that at any point in time? Is this you're optimizing individuals that are young and just want to get ahead of the curve, or is this somebody that's already having signs or symptoms?
It really depends on the client. So it can be anyone. Anyone can come in and ask for these tests. If you have, especially if you have cancer in your history. And so we'll screen everyone, and then we might recommend it. But there's a lot of people who just want to know. They just want the ability to know right now, can they detect cancer in me right now? And then they also might want to know their genetic predisposition to it as well. So it really is for anyone, depending on what their goals are.